You know that feeling, that sudden, like, overwhelming wave of fear that just hits you, seemingly out of nowhere.
Oh, yeah.
Maybe your heart is pounding like crazy, your breath gets all shallow and fast, you feel dizzy, the muscles in your chest might feel super tight, and for those few minutes, it just feels like something is terribly, terribly wrong.
Yeah, like the world is ending almost. It can be absolutely terrifying.
It really can.
And what's so interesting looking at the sources is that those physical feelings, as awful and scary as they are, they're often just your body's natural kind of ancient stress response kicking in. That whole fight, flight, freeze thing.
Right, but kicking in when there's no obvious danger.
Exactly. When there might not be a tiger right in front of you.
Okay, let's really dig into this.
Right.
Because we've been doing a deep dive trying to understand and manage panic attacks.
Yeah, we've gathered quite a bit. Info from health authorities, lots of practical advice from self-help guides.
And even some really relatable personal stories and tips shared in online communities, right?
Definitely. So our mission here with this deep dive is basically to boil all that down into the most useful, actionable stuff for you.
We want to get clear on what panic attacks are, what they feel like.
What you can actually do in the moment if one hits, and importantly, how you can help someone else going through it.
And then the longer-term picture too, right? Strategies to maybe lessen their impact over time.
Exactly. Think of this as building up your understanding and building your personal toolbox for handling these really intense experiences.
We're going to try and break down the information, make it easy to grasp, and maybe find those surprising facts or really practical tips that can help you feel, more informed and maybe a bit more prepared.
Sounds good. So starting at the core, what is a panic attack, according to the sources?
Well, they describe it as a sudden, often really unexpected episode of intense fear or discomfort.
It's not just feeling worried, it's like a peak, a concentrated burst of it.
And the symptoms.
Yeah.
Wow, they're incredibly varied. What really stood out from the sources was, that intense fear, obviously, but also the very physical side of it.
Like what specifically?
Sweating, that rapid breathing we mentioned, the racing heartbeat, feeling lightheaded or dizzy. Muscle tension is a big one.
Some people even describe a sense of impending doom. It feels incredibly real and incredibly scary while it's happening.
Totally.
And that ties straight back to that fight, flight, freeze response, Your heart races to get blood to your muscles.
Your breathing speeds up for more oxygen.
Your muscles tense up. It's all gearing you up to run or fight. It's survival.
But the saber-toothed tiger isn't there.
Exactly. And this is where we found one of the most, crucial pieces of information, understanding what a panic attack is, and maybe even more importantly, what it is not.
This seems vital, because so much of the fear comes from misinterpreting what's happening in your own body, right?
Precisely. And the sources are really clear on this. Despite how utterly terrifying they feel, panic attacks are harmless.
Harmless? That sounds counterintuitive when it feels so bad.
I know, but physically harmless. They won't cause you actual physical damage, even though it feels like your body is breaking down.
Okay, what else?
They're brief. They usually peak within about 5 to 10 minutes.
That fast. It feels longer.
It probably feels like an eternity. But they burn a huge amount of energy, so your body just physically can't maintain that peak intensity for very long. You might feel wiped out afterwards, sure, but the acute terror passes relatively quickly.
Okay, that's good to know. And interestingly, they're often private experiences.
Yeah, that came up too. Unless someone knows you really well, they probably can't tell you're having one. You feel like you're falling apart inside, but outwardly, you might just seem a bit pale or, fidgety.
Right. Now, let's tackle those scary misinterpretations head on. What are they not?
Okay, big ones. Panic attacks will not cause you to faint.
Really? Because you feel so dizzy sometimes.
I know, but your blood pressure actually goes up during anxiety. Fainting happens when blood pressure drops. So physiologically, it's the opposite.
Okay, that's huge. What else? You won't lose control.
Correct. You will not lose control. People having attacks still do controlled things. They might pull the car over, look for an exit, grab onto a railing.
They don't just, run screaming down the street uncontrollably.
No. You maintain control over your actions even while feeling panicked inside. You won't suddenly lose your mind or do something completely wild.
And related to that, you won't go crazy. That's a common fear, isn't it?
A very common fear. But no, you will not go crazy. No one has ever gone crazy from a panic attack. It's a temporary experience. It doesn't cause lasting mental breakdown.
Okay. And the big physical ones? Heart attack or suffocating.
Also not happening. That chest pain you feel. It's almost always muscle tension from the stress
Yeah.
and the shortness of breath.
Yeah, that feeling like you just can't get enough air.
It's usually because you're breathing shallowly and rapidly, but your body is still getting enough oxygen. It feels like suffocating because the sensation is so intense, but it isn't actually happening.
Wow. So that difference between how it feels and what's actually going on, that seems like the absolute key.
It really is. Understanding that distinction can take away so much of the secondary fear, the fear of the fear.
Okay, so why do they happen now? What do the sources say about triggers?
Well, it's a mix. Sometimes there are quite specific triggers. Things like being in confined spaces.
Elevators, tunnels.
Yeah, or big crowds, maybe having to do public speaking, or even getting into an argument. Those can set one off.
And this is the tricky part.
Yeah.
Sometimes they just happen.
Exactly. That came up a lot. They can strike completely out of the blue at totally random times with no obvious reason right then and there.
And that unpredictability must be terrifying in itself.
It is. And when someone starts having these recurring unexpected attacks, and especially if they start dreading the next one, that's when it can sometimes develop into what's called panic disorder.
Okay, what's the dynamic there?
It often comes down to that misinterpretation again. Consistently reading those normal, maybe slightly intense bodily sensations, like a faster heartbeat from climbing stairs, as dangerous. Thinking, oh no, here it comes again, or this means I'm having a heart attack, even after doctors have said it's anxiety.
So that creates a really vicious cycle, doesn't it? You have an attack, you think the feelings are dangerous.
Which makes you scared of having another one.
So you start living kind of on alert, constantly checking yourself, scanning for any little sensation.
Exactly. And being that hypervigilant, that constantly tense and on guard state, well, that can actually make you feel more nervous and anxious.
Which makes an attack more likely.
Oh boy. It can become a self-fulfilling prophecy, yeah. And this fear, this dread of future attacks often leads people to start avoiding things.
Places where they had an attack before, or situations that feel risky.
Precisely. Avoiding malls, avoiding driving on highways, avoiding being alone. Anything that reminds them of the panic or feels like a place where escape might be difficult if one happened.
There was a good analogy in one source, right? About a hiker.
Oh yeah, the hiker warned about a bear versus the one who wasn't.
Tell us that one.
Okay, so the hiker who's been warned there might be a bear in the woods hears a rustle in the bushes and immediately thinks bear, gets flooded with adrenaline, hyper alert.
Okay.
The hiker who wasn't warned hears the exact same rustle and just thinks, oh, probably a squirrel, and carries on calmly.
Ah, I see. So having a panic attack acts like that warning.
It kind of primes you. It makes you interpret every little internal rustle, a skipped heartbeat, a bit of dizziness as a potential bear, a sign of impending doom, even when it's just a normal bodily fluctuation.
Turning benign sensations into threats. Okay, that makes sense.
So, given that whole cycle, the sources really emphasize that managing panic isn't necessarily about stopping attacks cold turkey forever. Maybe that happens, maybe not.
But the main goal is...
The main goal is building up that toolbox of strategies so you can handle the feelings without that intense fear taking over, driving the avoidance and keeping you stuck in that on-alert mode.
Okay, so where do we start with that toolbox?
It really starts with a mindset shift. It sounds simple, but it's foundational. Remembering, truly trying to internalize that no matter how awful it feels,
It will pass.
it will pass. And it will not cause you physical harm. Acknowledge it. Okay, this is happening. This is a brief, intense burst of anxiety.
And trying not to fight it so hard.
Exactly. Allow it to happen. Allow the feelings to be there and try to recognize it for what it is your body or brain having a temporary, albeit strong, overreaction.
Okay, mindset first. Then what about physical techniques? Breathing came up a lot.
Hugely important. Breathing exercises are key. And the goal isn't necessarily to instantly stop the attack, but to consciously slow your breathing down.
Why does that help?
Because slow, controlled breathing sends a signal to your nervous system that the danger has passed, that it's okay to calm down. It makes it easier to kind of ride out those intense feelings without escalating them further.
So what specific techniques did the sources mention?
Well, there's deep breathing or diaphragmatic breathing. That means focusing on breathing slowly and deeply from your belly, your abdomen, not just shallow breaths from your chest.
Like making your stomach rise and fall.
Exactly. Maybe counting slowly to 4 as you inhale and 4 as you exhale, keeping it smooth and even.
Okay, what else?
There's the 4-7-8 technique. You inhale quietly through your nose for a count of 4.
Uh-huh.
Hold your breath for a count of 7.
Okay.
and then exhale completely through your mouth, making a gentle whoosh sound for a count of 8.
4 in, hold 7, 8 out. Got it.
And another one mentioned was alternate nostril breathing, using your thumb and ring finger to gently close one nostril while you inhale through the other, then switching for the exhale, and so on.
Seems like another way to just consciously slow things down.
It is. And the sources did note, these might feel a bit strange at first, especially when you're already panicked. You might even feel a little lightheaded initially.
So what do you do then?
Just take it easy. Maybe take a couple of normal breaths in between cycles if you need to. The point is gentle regulation, not forcing it.
Okay. Breathing?
Yeah.
What else physically?
Yeah.
Muscle tension is a big part of panic, right?
Huge. So muscle relaxation techniques can be really helpful. Progressive muscle relaxation is a common one.
How does that work?
You systematically tense a specific muscle group like your fist, hold it for a few seconds, and then consciously release the tension, noticing the feeling of relaxation. Then you move to the next muscle group, biceps, shoulders, face, legs, feet, working through the whole body.
So tensing and releasing.
Yeah, it helps you become aware of where you're holding tension and actively let it go. It sends calming signals back to the brain, too.
What about movement? Is it good to move or stay still?
Sources suggested movement can sometimes help, like light exercise, maybe just walking.
How does walking help?
It can physically remove you from a stressful environment, for one. And the simple rhythm of walking can actually help regulate your breathing naturally.
But wouldn't exercise increase your heart rate, maybe making things feel worse initially?
It might, yes. That's a potential downside during an acute attack for some. But for others, moving through the sensations, even if the heart rate goes up a bit, can feel empowering and help burn off some of that nervous energy. It depends on the person.
And just finding a quiet spot, if possible.
Absolutely. Moving away from intense sights or sounds, just sitting quietly for a moment can create some much-needed mental space.
Okay, that covers some physical tools. What about mental techniques? Grounding came up, right?
Yes, grounding is vital for pulling your focus away from the internal storm of panic and back to the external present reality.
What's a simple one?
One really simple one is just focusing intensely on a single physical object around you. Pick anything, a pen, a chair, a pattern on the floor.
And do what?
Really look at it. Notice its color, its texture, its shape. Imagine how it feels, who made it, where did it come from. Just pour your attention into that object.
To distract from the panic.
Less distraction, more redirection of focus. It narrows your attention away from the overwhelming internal sensations. Some sources even suggested carrying a small, familiar object, like a smooth stone or a textured coin, specifically for this purpose.
Like a tactile anchor?
Okay.
And the 5, 4, 3, 2, 1 method? That sounds familiar.
It's a classic grounding technique, yeah. You deliberately engage your senses.
How does it go again?
You look around and name 5 things you can see. Then you listen carefully and identify 4 distinct sounds.
Okay.
Then you notice the feeling of 3 things you can touch. Maybe your clothes, the chair, your own skin.
Mm-hmm.
Then identify 2 different smells. And finally, name 1 thing you can taste, even if it's just the taste in your mouth.
5 sights, 4 sounds, 3 touches, 2 smells, 1 taste.
Got it. Forces you into the here and now.
Exactly. It pulls your mind away from the what-ifs and scary thoughts and anchors it in the present moment through your senses.
What about mantras? Repeating a simple, calming phrase or word to yourself internally was also suggested. Something like, this feeling will pass, or I am safe right now, or even just a single word like calm or release.
Gives your mind something else to focus on.
And provides a bit of reassurance.
Now, another big mental strategy mentioned was realistic thinking, challenging the scary thoughts.
Yes, this is really core to CBT approaches, actively questioning those thoughts that trigger and fuel the panic, the fears of fainting, dying, going crazy, embarrassing yourself that we talked about.
So how do you challenge them?
Well, the sources talked about spotting 2 main kinds of distorted thinking that often happen during panic.
What are they?
The first is overestimating, believing that something unlikely or negative will definitely happen. This often relates to those physical fears like, I know I'm going to faint.
Okay, and the second?
Catastrophizing. That's imagining the absolute worst possible outcome and, crucially, believing you won't be able to cope with it. This often relates more to social fears like, if I have a panic attack here, everyone will stare, I'll be totally humiliated, it will be unbearable.
Right. So how do you fight those thought patterns?
You ask yourself questions like, okay, what's the actual evidence for this scary thought? What's the evidence against it? Is what I'm afraid of a real probability, or is it just a remote possibility?
Distinguishing likelihood? Okay.
And for those catastrophic thoughts, you ask, okay, What is the absolute worst thing that could realistically happen here? And if that worst thing did happen, how bad would it really be? Is it truly a disaster, a horror, or is it more like a hassle, an inconvenience, maybe embarrassing for a bit?
A hassle versus a horror. That's a useful distinction.
Yeah. And then, will this realistically matter in a week, a month, a year? And importantly, even if the worst happened, how could I cope? Brainstorming coping strategies, even for the feared outcome, can reduce the terror.
Like the example of fearing an attack at work.
Right. If you challenge that, you might realize, okay, the absolute worst is maybe I feel flushed, need to step out for a few minutes, feel a bit embarrassed. Is that ideal? No. Is it a career-ending horror? Probably not. It's more of a hassle, and people will likely forget about it quickly. And I could cope by taking a break, using my breathing techniques, maybe talking to a trusted colleague later.
Seeing it more realistically reduces its power.
Exactly. And one really practical tip related to this was creating coping cards.
What are those?
Literally writing down some of these realistic thoughts, these challenges to your fears, or some reassuring phrases. It's a hassle, not a horror. This feeling is temporary. I can handle this on a small card.
And carry it with you.
Yeah, carry it with you. Read it regularly, maybe every day to reinforce those ideas. And definitely pull it out and read it during an attack to help recenter your thinking.
That's a great practical tool. Okay, so mindset, physical techniques, grounding, challenging thoughts. What else was in the toolbox? Exposure seemed like a big one.
Yes. Facing your fears, or exposure therapy, was highlighted by many sources as arguably the most effective long-term strategy, often done with a therapist, but principles can be self-applied carefully.
What does it involve? It sounds scary.
It can feel scary initially, yes. It involves intentionally and repeatedly putting yourself in situations or experiencing sensations that you fear and have been avoiding because of panic.
So deliberately triggering the fear. Why?
Not necessarily triggering a full attack, but triggering the fear and the associated physical sensations. You do it gradually. For example, if you fear dizziness, you might practice spinning in a chair for a short time. If you fear a racing heart, you might do jumping jacks.
Okay.
Or if you fear crowded places, you might start by just standing near the entrance of a mall for a few minutes. The next time, go inside for 5 minutes, then 10, gradually increasing the challenge.
And the point of doing this is?
The point is to learn through direct, repeated experience that your worst fears don't actually come true. You spin, you feel dizzy, but you don't faint. You go into the mall, your heart races, but you don't lose control or have a heart attack. The sensations are uncomfortable, yes, but they are not dangerous.
So you're basically retraining your brain's fear response.
Exactly. You're proving to your amygdala, the fear center, that these situations and sensations are safe. You start with something that causes mild anxiety, stay with it until the anxiety naturally comes down, even by half, and then move up to slightly harder challenges.
And the key is to stay there, not run away.
Crucial. You have to stay in the situation or with the sensation long enough for your anxiety to decrease on its own. If you escape as soon as you feel anxious, you just reinforce the idea that the situation was dangerous and escape was necessary.
And the advice is to feel the feelings, not fight them.
Yes. Lean into the discomfort a little. Observe the sensations with curiosity rather than terror. Allow them to rise and fall naturally like waves. Fighting them just adds tension.
Okay. This also connects to safety behaviors, right? Things people do to feel safer.
Absolutely. A huge part of exposure is gradually letting go of those safety behaviors.
Yeah, like what? Remind us.
Things like always needing to carry medication just in case, even if you rarely take it. Always sitting near an exit. Avoiding caffeine or certain foods you think might trigger anxiety. Constantly checking your pulse or symptoms. Always needing to have your phone fully charged. Seeking constant reassurance from others, needing a safe person to go places with you.
Those sound like coping mechanisms. Why get rid of them?
Because while they might reduce anxiety in the short term, they maintain the underlying fear. They send the message, this situation is dangerous and I can only handle it because I have my safety net. You never learn that you can actually cope without them.
Ah, I see. They prevent you from disproving your fears.
Exactly. So a big part of exposure is identifying your safety behaviors and planning to gradually reduce and eliminate them as you practice facing the feared situations or sensations. Planning daily practice sessions for exposure is often recommended.
Okay, that's a lot for managing your own experience. Let's shift gears. What about helping someone else who's having a panic attack?
Yeah, the sources had some really good, clear advice on this. It's so important because the person having the attack might feel incredibly scared and confused, maybe not thinking clearly.
So what are the key things to do?
First and foremost, stay with them. Don't leave them alone unless they explicitly ask you to, and even then, maybe stay nearby.
Okay. Stay calm yourself.
Try your best. Your calm presence can be really grounding and reassuring for them. It signals safety.
Good point. What else?
If possible, gently suggest moving to a quieter place, away from noise and crowds. Ask them simply what you need right now. Listen to their answer.
Keep communication simple.
Yes. Speak in short, clear, simple sentences. Avoid overwhelming them with too much talk or complex questions. Be predictable in your movements. Avoid surprises.
Can you help them focus?
You can try. Maybe suggest a simple physical task like, can you try wiggling your toes? Or lift your arms up slowly. Or gently guide them through a grounding technique like the 5-4-3-2-1 method if they seem open to it.
What about their breathing? Can you help with that?
You can. You could try breathing slowly and calmly with them, exaggerating your breath slightly so they can follow along. Or you could gently count slowly to 10 with them, focusing on the exhale.
And what kind of things are helpful to
The
say?
reassuring, simple phrases are best. Things like, you can get through this. I'm right here with you. Just focus on your breathing. Stay in the present moment. What you're feeling is really scary, I know, but it's not dangerous.
Anything else?
One source suggested, if appropriate, reminding them. It's not the place that's bothering you, it's the thought. Sometimes that helps create distance. And simple encouragement like, I'm proud of you or good job can be validating.
Okay. And equally important, what not to do.
Definitely don't tell them to just calm down or relax.
Why not? Isn't that the goal?
It is. But telling someone in the midst of panic to just calm down often feels dismissive, like you're minimizing how bad they feel. It can actually increase their anxiety or frustration. Same with saying, there's nothing to worry about. Their body is screaming that there is something to worry about, so it invalidates their experience.
Good point. Avoid minimizing or dismissing.
Exactly. Just be present, calm, and supportive.
What if you see a stranger having an attack in public?
Approach calmly. Introduce yourself quietly. Ask something simple like, are you okay? Do you need any help? If they respond, you could ask if they've had one before or if anything usually helps them. Offer to stay with them or call someone for them if needed. Respect their wishes if they want space, but maybe keep an eye on them from a distance if possible.
Makes sense. And for yourself, if attacks tend to happen in certain places, like work.
It can be really helpful to talk to a trusted colleague or supervisor beforehand when you're calm. Let them know what happens and what kind of support is helpful for you specifically. That way, if it happens, someone knows how to assist without guessing.
Proactive communication. Good idea. Okay, let's look at the bigger picture now. Long-term management and prevention. What did the sources suggest?
This section was really about building habits and strategies to lower your overall baseline level of anxiety. The idea is that a lower general anxiety level might make you less susceptible to tipping over into a full panic attack, or might make attacks less frequent or intense if they do happen.
And lifestyle factors seem pretty fundamental here.
Absolutely foundational. Sleep was mentioned repeatedly. Prioritizing getting enough good quality, restful sleep is crucial. Poor sleep just makes anxiety so much worse.
Diet, too.
Yep. Focusing on a healthy, balanced diet, avoiding excessive caffeine, which can mimic anxiety symptoms, watching sugar intake, avoiding using alcohol or other substances to cope, as that often backfires, and staying properly hydrated. Dehydration can sometimes contribute to feeling unwell.
And exercise, of course.
A huge one. Regular physical activity is incredibly beneficial. Aiming for something like 30 minutes of moderate activity, like brisk walking, cycling, swimming most days of the week.
Why is exercise so good for anxiety?
It releases endorphins, which are natural mood boosters. It helps burn off stress hormones like cortisol. It improves sleep. Over time, it's just a really powerful tool for reducing general anxiety and improving resilience. And of course, avoiding or reducing alcohol and smoking was also strongly recommended.
Makes sense. What about support systems?
Also vital. Having people you trust, friends, family that you can talk to honestly about what you're experiencing can make a huge difference. Feeling less alone with it can really ease the burden. Support groups, either online or in person, can also be incredibly helpful.
Connecting with others who get it.
Exactly. And then therapy and specific learning strategies are highly effective pathways.
CBT came up a lot, cognitive behavioral therapy.
Yes, CBT is often considered the gold standard therapy for anxiety and panic disorders. It directly targets those unhelpful thought patterns we talked about, helps you challenge them, and teaches you practical coping skills like breathing, relaxation, and crucially, exposure.
Exposure therapy is often part of CBT then.
Yes, very often. That gradual confronting of feared situations and sensations is a core component for panic.
What about other kinds of therapy?
General talking therapy or psychotherapy with a mental health professional can also be really valuable. It can help you explore potential deeper roots or underlying causes of your anxiety and develop personalized coping strategies.
Learning about your own triggers seemed important too.
Definitely. Paying attention and identifying patterns when and where do attacks or high anxiety tend to happen for you. What situations, thoughts, or feelings often precede them.
How does knowing your triggers help?
A professional can help you sort out which triggers might be genuinely harmful situations to avoid versus which are triggers based on fear that you actually need to learn to approach and manage through exposure. Understanding your patterns gives you more control.
Mindfulness and meditation were also recommended.
Consistently, regular practice of mindfulness or meditation can significantly reduce overall stress. It helps you become more aware of your thoughts and feelings without automatically reacting to them. It promotes calmness and self-regulation.
And probably makes it easier to use those breathing techniques when you actually need them.
Absolutely. If you practice calm breathing regularly when you're not anxious, it becomes much more accessible and effective when you are.
There was a practical tip about writing down stress signs too.
Yeah, becoming aware of your own personal early warning signs of stress building up. What are your typical symptoms? Is it headaches, irritability, trouble sleeping, muscle aches? And what are your common stressors? Work deadlines, financial worries, relationship issues.
So you can intervene earlier.
Exactly. If you can recognize, I'm starting to feel X, Y, and Z, and I know work is stressful right now, you can proactively use your coping tools. Take a break, do some deep breathing, go for a walk, talk to someone before things escalate to a breaking point or a panic attack. It's about developing a conscious response to your stress response.
Managing stress before it manages you. Okay, what about medication?
The sources definitely acknowledge that for some people, especially with recurring or severe panic attacks that really interfere with life, medication prescribed by a doctor can be a very important and necessary part of treatment, usually alongside therapy and self-help.
What kinds of medications?
There are generally two types. Some are for as-needed relief during an attack, or high anxiety, things like benzodiazepines like Xanax or Valium, or sometimes beta blockers.
But there are warnings with those.
Yes, sources caution that benzodiazepines in particular can be habit-forming, cause drowsiness, and have interactions with other substances like alcohol. They're generally intended for short-term or infrequent use under close medical supervision. Beta blockers mainly help with physical symptoms like racing heart, but not the fear itself.
And the other type.
Daily preventative medications. SSRIs, selective serotonin reuptake inhibitors, which are a class of antidepressants, are very commonly prescribed for panic disorder. They work over time to help reduce the overall frequency and intensity of attacks.
So they help prevent them from happening as often.
That's the goal, yes. But, like all medications, they can have side effects and need to be taken exactly as prescribed by a doctor. It often takes several weeks to see the full benefit.
So medication can be a tool, but always with a doctor's guidance.
Always. It's a discussion to have with your doctor about risks and benefits for your specific situation.
The sources also touched on the impact on family.
Yeah, just a reminder that panic attacks don't just affect the individual. Family members might feel worried, frustrated, confused, or even burdened sometimes. Open communication is key. And if things are really difficult, family therapy might be something to consider to help everyone cope and support each other effectively.
Good point. And finally, maintaining progress. It's not a one-time fix.
Definitely not. Managing anxiety is often described as an ongoing process, like staying physically fit. You have to keep practicing the skills, the breathing, the realistic thinking, maybe occasional exposure practice to keep them sharp.
Keep the tools polished.
Exactly, and it's normal to have setbacks or relapses, especially during stressful periods. The key is not to see it as failure, but just to recognize it and get back to using your tools. Sources encouraged acknowledging your progress, rewarding yourself for effort, and practicing positive self-talk.
That all sounds really hopeful and actionable. Now, for listeners who want to dive even deeper, our source material mentioned quite a few specific books and resources.
Yes, there was a really rich list, covered a lot of ground. Things like general anxiety books, The Anxiety Cure, The Body Keeps the Score, which looks at trauma's physical impact. CBT guides like Overcoming Anxiety.
Mindfulness books.
Yeah, classics like Wherever You Go, There You Are, and books focused specifically on panic, like One Can Dare was recommended. Also, practical workbooks like the Anxiety and Phobia Workbook.
What about understanding the brain science?
Rewire Your Anxious Brain was suggested for that angle, explaining the neuroscience behind anxiety and how to change those patterns.
It was interesting seeing the different therapeutic approaches reflected in the recommendations, too.
Yeah, some resources lean heavily into the CBT approach of identifying and challenging thoughts. Others come more from an ACT, acceptance and commitment therapy, or mindfulness perspective, focusing more on observing thoughts without judgment, accepting uncomfortable feelings, and committing to valued actions despite anxiety.
But there seems to be a common thread.
Definitely. A shared idea seems to be that thoughts, especially anxious or panic thoughts, are not always accurate reflections of reality, and you don't have to automatically believe or be controlled by every thought that pops into your head.
What other kinds of resources came up?
Beyond books, people in online communities mentioned things like the Huberman Lab podcast for neuroscience insights. Some found comfort in specific religious texts, like Surah ad-Duha from the Quran was mentioned, and specific therapy workbooks like those used in DBT, dialectical behavior therapy, which teaches skills for emotional regulation and distress tolerance.
It's lots of avenues to explore. And just to loop back on medication,
Yeah, worth reiterating. For many people, medication prescribed by a doctor is a valid, helpful, and sometimes essential part of managing severe or persistent panic, usually best used alongside therapy and these self-help strategies.
and the bottom line is, if panic attacks are happening frequently, severely impacting your life, or if you ever have symptoms that feel like they could be something serious like a heart attack,
Please seek professional medical attention. Get checked out. Panic disorder is a real, recognized condition. It affects many people, and effective help is absolutely available. Don't suffer alone.
absolutely. So wrapping this up, what we've really seen from this deep dive is that panic attacks, while feeling incredibly terrifying, are fundamentally understandable. They're a physiological response.
Right, and the good news is there are concrete, evidence-based strategies you can learn and use, from those immediate coping tools like breathing and grounding.
To the longer-term work on lifestyle, therapy like CBT and exposure, building support, and potentially medication if needed, these things can genuinely make a huge difference in reducing the fear and impact of panic.
Knowledge really is power here, and building that toolbox takes practice, consistency, and patience with yourself.
Okay, so as we finish, here's something to maybe mull over.
Yeah.
Our body's fight-flight-freeze system, this incredibly powerful instinctual response, it evolved over millennia for survival against real physical threats.
Right.
Predators, attacks, natural disasters.
Immediate, tangible danger.
So what does it signify about us living in this modern world that this exact same intense, all-consuming physiological system can be triggered just as strongly, sometimes even more strongly?
By just a thought, by an interpretation, by a memory or a worry about the future.
What does that reveal about the incredible power of our minds, both its capacity to generate immense distress, but also, hopefully, its potential for finding resilience, calm, and managing these experiences?